Assalamualaikum. Testing, testing. Assalamualaikum warahmatullahi wabarakatuh. And a very good evening. So first and foremost, saya ingin memperkenalkan diri saya. Nama saya Halimah binti Abdul Halim. Saya seorang paediatric doctor. So paediatric training and has been practicing paediatrics daripada tahun 2012 until now. So it has been about 5 years. Saya juga mempunyai 5 orang anak. So I have 3 girls and twin boys. Currently I am working dekat Alder Hay Children Hospital in Liverpool. So inshallah that's a little bit of a background of my background. So malam ni inshallah kita akan cover a topic about common childhood illness. So talk malam ni is more for parents. So nak share some information and to educate about common childhood illness. So kalau ada yang medical student yang listen to this talk might be a little bit more superficial. So inshallah there will be another pediatricnya talk yang akan go into more details lah of the pathology and management of those disease. So malam ni is more catered for parents. More catered for parents untuk diorang boleh belajar lah a little bit more about the common childhood disease yang kita selalu jumpa lah. So insyaAllah malam ni saya akan sharekan a slide. So my presentation will be based on these slides. So hopefully bear with me. And then kalau ada soalan, question and answer, insyaAllah we'll share a session at the end of this talk. Bolehlah write the questions at the side. Okay. So I can start sharekan. So the presentation ada kat dalam dekat the link as well. Okay. I'm just gonna check whether semua orang boleh nampak tak. So this is the PDF presentation. Okay. So inshallah the topic is common childhood diseases or illness in children. So topics yang kita akan cover tonight will be what are the common childhood diseases that we commonly see either dekat GP practice ataupun even in A&E dekat hospital. Number 2, kita akan cover how parents can manage them at home. So a lot of these diseases memang parents can actually manage them at home. And then when do you seek medical help? How do you seek the medical help? So there are many ways that you can seek medical help for this. So inshallah we'll try cover it as well tonight. So the common childhood diseases yang saya nak cover malam ni ada about 9 of them. So bear with me. We might whiz through it, tapi it might take a while jugalah. So the first one yang saya nak cover is upper respiratory tract infection. So daripada nama dia pun kita boleh faham lah. Maksudnya it's an infection of the upper respiratory tract. So upper respiratory tract includes the nose, the mouth, the throat, and also your ears. So daripada hidung, mulut, tekak, and also telinga. So upper respiratory tract infection ni most commonly are caused by viruses. Ni kalau kat sini dia orang biasa panggil common cold lah, flu, common cold tu semua are all about the same thing. Ataupun kalau bahasa Melayu dia selalu panggil demam sesama kan. So simptom-simptom dia adalah runny nose, so sesama tu sendiri, cough, bunged up. So kalau baby selalunya bila dia bunged up tu kita nampak lah macam bila dia bernafas tu bunyi kan, bunyi macam tersekat-sekat. And then sore throat, and then they can have earache as well. They can sometimes have fever with this. So kadang-kadang kita panggil demam sesama kan, dia kadang-kadang demam dengan apa sesama tu. So sebenarnya common cold ni memang very memang selalulah, especially bila it's winter time. So masa winter we get a lot of viruses, and kadang-kadang budak-budak ni they get one virus after another. So virus ni banyak, all kinds of types. Kita ada RSV, kita ada adenovirus, rhinovirus, anthrovirus, and then kita ada the influenza, all the flu viruses kan. So memang banyak. So kadang-kadang budak-budak they can get one virus after another, especially kalau school age ataupun yang duduk kat nursery kan. So it's very common. Not to say kadang-kadang budak tu tak unwell, kadang they can be boleh tahan quite unwell with it. Tapi treatment dia most commonly memang kalau budak tu is not that bad, they boleh treat dekat rumah je. So dia bukan treat, dia more supportive management. So kita support the child. So kalau dia ada fever ataupun budak tu macam merengek-rengek, kadang-kadang a bit clingy, nampak macam tak selesa badan kan, we can give them paracetamol sebab sometimes that relieves the fever ataupun the body aches. Other supportive treatment that we can give is actually bagi lots of fluids. So kita kena make sure they have enough fluids. Kalau diorang stop eating, it's okay sebab children can actually go without food for a few days. Tapi they can't go without fluids. So kena make sure they have enough fluids. Make sure they are drinking when they have this runny nose. Kadang-kadang kalau babies, we can give them saline drops. So saline nasal drops ni you can get from pharmacy, and basically the way it works is by drying up the mucus lah. Tapi bukan semua works. So sometimes some babies it actually makes it worse. So kita boleh try, but if it's not getting any better or it's actually making it worse, then you don't have to use it lah. You can also use oil bath. Oil bath ni dia macam drops yang kita dropkan on handkerchief. So you drop kan, dia macam ada eucalyptus and macam menthol sikit, so dia macam berangin sikit. So sometimes that open up the nasal cavity tu kan, yang ada macam banyak mucus tu. Dia macam Vicks lah juga. Tapi it's quite safe, so it's safe for babies as well. Like satu, you can use nasal suction. So nasal suction ni you can buy, it's like a tube yang you boleh beli dekat Boots. So basically you suck by, dia macam ada tube yang you suck at one end and the other end tu letak dekat nose baby lah. Sometimes that can help with the nak keluarkan some of the secretion dekat dalam nose. And then I've put that TLC, so tender and living care. So actually budak-budak ni bila diorang ada cold flu viruses ni, they just need to be a lot of cuddles and a lot of hugs and a lot of, sebab diorang rasa tak selesa kan. So a lot of tender and living care insyaAllah will help lah. Eventually the viruses tu badan baby tu, badan budak tu will actually fight the viruses themselves. So kita hanya support them. And when to seek medical help is when kalau baby tu is less than 6 months, maksudnya dia feeding only milk and they're taking less than half of their normal feed. So katakan dia biasa minum 8 botol berapa ounces, tapi setiap kali dia ambil botol tu dia only ambil less than half of what they normally take, then you need to bring the baby to see a doctor. Sebab maksudnya they're taking less than half of how much fluids that they take throughout the day. And then the other sign to look out for is kalau dia become very lethargic and very drowsy. So macam it's not just sleepy. So macam kadang bila dia orang sakit memang they sleep more, which is fine. Tapi they need to have intermittently they are arousable. Maksudnya kita boleh kejutkan dia. Maksudnya dia bukanlah tidur dan tak boleh bangun dan tak nak menyusu langsung. Ataupun kalau budak-budak pun macam tu lah, macam terbaring and will never wake, macam tak boleh wake up. Lagi satu, if they have reduced wet nappies ataupun urination. So kalau babies tengok wet nappies dia lah. Kalau they have less than 2 throughout the 24 hours, then you need to bring to see a doctor. Kalau budak-budak yang dah besar, kita tengok dia urinate kan, dia pass urine tu less than twice in a day, then you need to bring the patient to the GP or doctor lah, sebab nak make sure they are not dehydrated. Okay, so that is upper respiratory tract infection. The second one is bronchiolitis. So bronchiolitis ni sebenarnya it's an infection of the bronchioles. So macam dalam gambar rajah ni, bronchioles ni ada small tube at the end of the lungs. So macam kalau kita tengok yang dekat at the end of the lungs kan. So dia bila ada infection, the small tubes ni kadang-kadang dia jadi inflame and then dia jadi narrowed lah. So it makes it harder for the baby to breathe. So bronchiolitis ni is a viral infection of the small tube in the lung. So basically it's caused by the same kind of virus yang you get in the upper respiratory tract infection. So sama RSV, adenovirus, rhinovirus, it can go down to into the lungs and it infects the small tube in the lungs. And this is common, memang bronchiolitis ni is only in children below 2. So the bigger bila dia orang dah besar, it's not bronchiolitis anymore, it's called viral induced wheeze. So it's a different ni lah. So kalau yang below 2 ni most commonly is bronchiolitis. So the sign and symptoms that they get is they get this crackly and wheezy sound. So dia macam bunyi, kejap lagi nanti saya tunjuk bunyi crackles lah, crackles and wheeze, and then also cough, and they can get difficulty and increased work of breathing. InsyaAllah nanti later I will show you what does it means by increased work of breathing. Macam mana kita nak tengok, macam nak assess anak kita tu ada increased work of breathing ke tak. And also macam mana bunyi crackles and wheeze ni. Kejap lagi saya akan tunjuk. So the treatment for bronchiolitis ni is the same as upper respiratory tract infection. So kita support the child. So kita bagi paracetamol kalau dia ada fever or dia look a bit grumpy. Kita bagi supportive treatment, banyak lots of fluids. Kalau dia tak makan pun tak apa. And the same thing like saline nasal drops, oil baths, nasal suction and TLC. And then when do you seek help? So kalau bronchiolitis ni ataupun kalau budak yang besar kita panggil viral induced wheeze, you look up for the same thing. So budak-budak yang viral induced wheeze lebih besar pada 2 tahun ni, diorang pun macam tu lah, dia start dengan runny nose and then it goes into their lungs and they start having difficulty breathing. So you only seek help, maksudnya you only bila yang nak kena jumpa doktor ni is when kalau dia babies, sama jugalah, less than 6 months. Kalau dia feed less than half of their normal milk punya intake, then you have to bring to see the doctor lah. Ataupun any signs of dehydration. So signs of dehydration macam tadi, dia punya wet nappies less than 2 in a day. Ataupun budak yang besar, they are not, they are passing urine less than twice in a day. Ataupun there's signs of increased work of breathing. So insyaAllah saya akan share a video about what is increased work of breathing. So kalau kita tengok dalam video ni, this is budak ni dia ada increased work of breathing. So kalau tengok dia punya chest tu, it inflows dalam, bawah, and then bawah ribs dia tu termasuk ke dalam. So macam bawah ni boleh nampak dia termasuk ke dalam, and then in between ribs dia pun macam termasuk ke dalam tu. So that's a sign of increased work of breathing. Budak ni pun ada increased work of breathing. So kalau tengok dia punya bawah ribs dia termasuk kan, dia ada indrawing of the ribs. And then bawah ribs itu. This is a normal breathing. So budak ni bentuk chest dia memang termasuk. Kalau tengok, kalau anak-anak kita ada some of them yang bentuk chest termasuk. Tapi bawah ribs dia ni, dia tak macam termasuk ke dalam kan. So means that this is normal. And this one as well. Yang ni pun dia normal breathing. Okay. So this is the sound of crackles and wheeze. Tapi wheeze dia tak kuat sangat. So just have a listen. This is the sound of crackles that you can sometimes hear even without stethoscope. So kalau dia ada bronchiolitis, sometimes you can hear this sound. Okay, so that is the sound of crackle. So tadi kita ada cakap crackly and wheezy tu, that is the sound lah. Dia bunyi macam crackle, dia macam kalau kita ambil macam mana, kalau ambil macam kertas tu dia macam kita kumpul-kumpul kan, dia bunyi macam tu, bunyi crackly. Ataupun bila api bakar kayu kan kita dengar bunyi crackles kan, macam tu lah. It's the same. So kalau ada any of this, kalau boleh dengar crackles and a bit wheezy, and kalau kita pegang pun kita boleh dengar bunyi macam berair-air kat dalam dia punya dada kan, that is okay as long as dia tak ada increased work of breathing. So kalau dia punya breathing ada yang that indrawing in the ribs tu, tu kena bawa jumpa doktor lah, so that they can just check the patient. Sometimes dia orang check and dia orang rasa macam it's okay, tak ada apa-apa masalah, dan tak apalah. It's better to get it checked bila dia ada increased work of breathing, so sometimes you don't know how unwell the child is kan. Okay. So the next one is a chest infection. So chest infection ni, this is caused by bacteria, and this is about the only time that they will need antibiotics. So sometimes memang some doctors do overtreat. So macam they don't have chest infection pun dia bagi, it's bronchiolitis pun bagi antibiotics, but antibiotics doesn't work against viruses. So this is the only instant bila kita bagi antibiotics. So the sign for chest infection is actually fever, and fever dia bukan low grade fever, dia macam normally it's high grade fever lah, so more than 38.5. Dia selalunya ada cough of breathing, so nampak macam dia breathe quite rapid, quite fast, and dia ada that recession tu. So kalau dia ada any of the symptom, you need to see a doctor, sebab sometimes you nak differentiate between bronchiolitis and chest infection, and the only way you can differentiate is actually doctor to have a listen dengan stethoscope dia lah. So dia ada different signs bila kita listen to guna stethoscope tu. Okay, the next one is croup. So croup ni pun quite common we see in A&E. So croup ni is a viral infection of larynx and trachea. Kalau kita tengok the diagram ni balik, larynx is here. Larynx ni is where your suara, your vocal cord. And then your trachea is the one yang down here. So bila you have infection around this tube, around this side of the tube, dia akan jadi narrowed. And then budak-budak kecil, so croup only happens in children. So bila dia, masa dia children, their larynx, their trachea ni tends to be smaller. So bila it gets infected, dia jadi inflamed. And bila inflamed, dia jadi narrowed. And then kita akan dapat all the signs and symptoms of croup lah. So signs and symptoms of croup ni is we get the common macam cold, sebab they're caused by the same kind of viruses. So dia kan ada runny nose, a bit of sore throat, and then tiba-tiba dia ada start having this barking cough. So barking cough ni dia macam anjing menyalak, ataupun macam orang sini dia panggil macam seal. So dia macam bunyi anjing menyalak punya kind of cough. And then they can have this noisy breathing which is called stridor. So stridor ni bunyi dia macam ni. So have a listen to this ni, and this is the sound of the stridor. Okay, so those two are the sounds of stridor. So you'll never forget the sound because it's dia bukan macam batuk ke apa. It's a weird sound bila dia tarik nafas. So kalau dia start ada bunyi stridor tu, that's when you need to see a doctor, sebab bila dia dah ada stridor tu maksudnya dia ada the airway tu dah start closing. So your trachea dah start closing. If it is just barking cough, then tak payah buat apa-apa. It's only when you have stridor. Dan stridor ni kadang-kadang dia intermittent. So bila budak tu macam bila dia start nangis-nangis and restless, dia start ada stridor. Tapi bila dia calm, duduk, tak nangis-nangis, minum susu je ke, dia biasanya tak ada stridor. Even if it's intermittent stridor, then you should bring the child to see a doctor, sebab they need some steroid. So steroid tu what it does is it brings down the inflammation. And it's only one dose. So dia bagi one dose of high dose steroid. And it covers the time about 72 hours lah, so that the inflammation goes down and the child tak ada danger of the airway closing. So that is croup. It's quite common juga lah we see croup ni. The next one is viral gastroenteritis. So kalau tengok nama dia pun, kalau medical memang boleh tahu lah. So it's caused by a virus, not a virus. It's caused by viruses, and it's an infection of the stomach and your gut, so all your bowels and stuff. So dia punya kalau nak kata bahasa Melayu dia ialah apa ni, cerit berit dan muntah lah. Bila kita ada cerit berit dan muntah tu, diarrhea and vomiting tu, that is viral gastroenteritis ni lah. Yes, and then symptom dia is they get diarrhea, they get vomiting, and they can sometimes have fever with it. They can also have sore throat and runny nose. So sometimes it's the same viruses that can cause runny nose, sore throat. It can go down to your bowels. So these viruses are quite nasty lah. So dia boleh pergi dekat your throat. It can go down to your lungs. It can go down to your stomach and your bowels. Kalau dia go down to your stomach and bowels, you tend to get diarrhea and vomiting lah. Kalau dia just go to gastro, kalau dia pergi your stomach je, sometimes you can just get vomiting, tak ada diarrhea. Tapi sama macam all the other viral illnesses, the treatment is satu, fever tu you give paracetamol for the fever and body aches. Fluid management is important dalam diarrhea and vomiting ni, sebab kita tak nak the child become dehydrated. Bila dia orang vomit and bila they have diarrhea, they tend to be very thirsty. So budak-budak ni kalau kita offer like a big cup of fluids, fluids, dia orang memang akan gulp it down. Tapi that's the reason why they will start vomiting again. So nanti kita akan jumpa parents yang datang kata every time dia minum dia muntah, every time dia minum muntah. Kalau baby bagi a full bottle dia muntah kan. So the treatment is actually kita bagi fluids, small amount tapi frequent. So you don't give a full bottle, you don't give like a big cup. Nanti sebab ni dia akan just gulp it down kan. So the treatment is actually you bagi fluids, small amount tapi frequent. So kalau macam baby tu, instead of an 8 ounce bottle yang biasa dia ambil tu, you do it 2 ounces but you do it more frequently. So you bagi 2 ounces and maybe dalam another maybe dia feed early and normally dia ambil 8 ounces in the 4 hours. So instead of bagi macam tu, you bagi every 1 hour tapi bagi 2 ounces. So small amount tapi you bagi more frequent. And then sometimes, very sometimes, babies ni milk can make it worse. So macam they can make the diarrhea and vomiting worse. So kalau macam tu, we should what you can do is you can change it to diarrhelite. So diarrhelite ni you can get from pharmacy, and you can mix it with a bit of squash to make it taste nicer, and you can give it, and they can stay on this for maybe 2-3 days. If kalau babies and dia punya diarrhea vomiting lasting more than 2-3 days and has been on diarrhelite je, you need to get help. Tapi kalau budak-budak lain, it can go longer lah. You can just give diarrhelite dengan ni for a bit longer. Like satu, untuk food. So children can go a few days without food. So kalau dia ada diarrhea and vomiting and they are off their food, dia tak nak makan, that's fine as long as dia minum. Tapi kalau dia nak makan, make sure it's soft and light diet. So jangan bagi benda yang oily because it will irritate the stomach and then they will vomit. So bagi something yang light like toast, biscuits, apa-apa yang diorang nak lah. The other good thing is actually ice lollies. So macam sebab it controls the temperature, it gives them some sugar and it will give some fluid. So ice lollies are good masa viral gastroenteritis ni lah. So when to seek help, so kalau they are not taking sufficient amount of fluids. So contohnya babies yang less than 6 months, they are taking less than half of what they're normally taking. Ataupun budak yang more than 6 months, they are taking less than 500 mils. Kalau more than 1 year, they are taking less than 700 mils. Or kalau ada any signs of dehydration. So sometimes they are taking enough, tapi rupanya they are having diarrhea more and vomiting more than actually what they are taking. So they can have signs of dehydration. So signs of dehydration are dry tongue. So dia punya tongue very furry and very dry. And then they can wet nappies, diorang less than 2 in a day. Ataupun budak yang besar less than 2 passing urine in a day, ataupun they are very drowsy or lethargic, ataupun sunken eye. But sunken eye ni it's susah nak detect. So sometimes nanti you tengok anak you lawak sunken ke tak. So I would go with dry tongue and the passing urine ataupun the drowsy and lethargy. So that is viral gastroenteritis. The next one is febrile convulsion. So yang ni kalau orang Melayu dia panggil sawan. So dia you get a seizure with fever. So bila dia ada temperature sikit je, bukan sikit lah, when they have a temperature, high temperature, then they have a seizure. Temperature dia doesn't need to be 40. So the common mistake is people ingat, oh kalau dia sangat panas baru they have a seizure. No, they can have febrile convulsion at temperature of 38.7. So dia just ikut budak. So some budak ada higher threshold, some budak tak ada. Sometimes some budak memang akan kena febrile convulsion. So dia different child is different. Tapi dia basically seizure with fever. So kalau seizure without fever is not febrile convulsion. So you need to check. You need to see a doctor straight. Kena bawa jumpa doktor lah. Tapi kalau seizure with fever is febrile convulsion. So you manage this child. Bila dia ada seizure, time dia tengah ada seizure tu, you put them on their side. So tak kira lah left to right. Ada kalau medical background sometimes they say more on the left kan. Tapi tak kisahlah mana, tak payah nak ingat which way. Just put them on the side. And pegang, and then you time the seizure. So kalau jangan straight away call ambulance. So jangan bila nampak budak tu tengah sawan kita terus call ambulance. Tunggu dulu. So put them on the side. Tengok time. Kalau by 5 minutes budak tu tak stop seizing, maksudnya mesti ada sawan at 5 minutes, you need to call the ambulance. Sebab then they need some protection to their airway lah. Tapi kalau setakat 2-3 minit, it's okay. So kalau after 2-3 minutes dia stop, then you should be okay. Tapi make sure you bagi paracetamol or an ibuprofen, make sure you control the temperature. The child can be a bit sleepy after the seizure, which is quite common. But they should come back after that lah. After the seizure, they should start buka mata and sedar. Sometimes they cry because it's actually not a nice thing to happen to them. Kalau they actually stop breathing, you need to call the ambulance. So kalau after 5 minutes you tengok dia still blue and still seizing, you need to call the ambulance. The other reason you need to go and see a doctor, so kalau benda ni jadi less than 5 minutes and budak tu sedar lepas tu and okay, just control the temperature should be fine. You don't need to get it checked lah basically. Sebab it's just febrile convulsion. Tapi kalau dia ada temperature but you can't find the source of infection, so dia tak ada sesama, dia tak ada batuk, dia tak ada diarrhea vomiting, dia tak ada any signs of infection lah, tapi tiba-tiba dia ada fever kan. Maksudnya you can't find the reason kenapa dia ada fever, especially in children less than 1, kena bawa jumpa doktor sebab then dia kena check, mungkin nak kena tengok dalam telinga sebab sometimes kan ada infection dalam telinga kita tak nampak kan, infection dalam throat, kadang-kadang dia ada infection kat chest tapi tak ada batuk, so kena bawa jumpa doktor. Kalau kalau parents tak boleh nampak reason, kalau dia ada cough then tak apalah, kalau dia ada sesama then fine, you know it's because of dia sesama, that's why dia demam. Tapi kalau tak jumpa then you need to jumpa doktor. The other common mistake is people ingat teething can cause temperature fever. So generally we don't say lah teething can cause temperature. So kalau it's just, kalau you can't find anything tapi nampak macam baru nak tumbuh gigi, not too safe to say it's the teething lah. So need to see a doctor still. So the next one is conjunctivitis. So conjunctivitis ni is infection of the eye. So the eyes will become red and watery and itchy. And most commonly memang caused by viruses. So sama macam all the other viral illnesses, the same kind of viruses can cause conjunctivitis. Kalau it's caused by a virus, they do not need any treatment. Tapi kalau tengok benda tu lama and very gunky and nampak macam very sore looking, bolehlah bawa jumpa doktor because sometimes they are bacterial and kita boleh bagi chloramphenicol drops, tapi kena jumpa doktor lah. So kalau dekat rumah, kalau baru ada this red sticky watery eye ni, all you need to do is clean the sticky eye with cotton wool yang kita wet in warm water, and make sure you do it from the inner eye to the outer, and jangan use the same cotton wool for the next eye. And it's very contagious, so kena make sure kita tak share towels antara adik-beradik, and then make sure kita punya hand hygiene is very clean lah. So bila kita clean the eye tu, make sure kita wash our hands properly, kalau tidak kita akan spread it. So when to seek medical help is when kalau eyelids around the eye tu, so kalau the eyelid becomes very swollen and very red, you need to you need to go and see a doctor because you might need antibiotics. So kalau the eyelid around tu memang looks very swollen, then you need to see a doctor. Okay, this is another very common presentation yang kita selalu jumpa lah, rashes. So children get all kinds of rash. Nanti insyaAllah at the end of this we'll share about which rash yang very important, yang memang doctors look out for this kind of rash because dia ada significant, tapi which rashes yang lain yang tak perlu risau sangat lah. So kalau kita tengok dalam gambar ni, this first gambar, this boy ni, he has got measles. So this is measles kind of rash. And if you look at him, he looks very miserable kan. Nampak macam very miserable child. So this is measles. This one on the right ni, this is rubella. They almost look very similar. So it's very difficult to just diagnose it from the rash itself. Tapi sometimes from history, doctor can diagnose it lah. And this rash is viral rash. So kalau medically, it's called viral exanthum. So viral rash ni pun, they are caused by all those viral illnesses. So kalau kita ada those cold flu symptom, ataupun kita ada earache, ataupun kita ada the bronchiolitis, atau the diarrhea vomiting, and conjunctivitis, you can get this kind of viral rash. They can sometimes be mistaken as measles. So sometimes orang ingat, oh, this is measles, but they are not. So this is just a viral rash. So, okay, this is the third one. Okay, this is a bit more interesting one lah. This is chickenpox rash. So chickenpox rash, kadang-kadang it can start with red dot macam ni. Lepas tu dia just a red dot. Lepas tu dia start filling up with fluid. So dia vesicular. Kita panggil vesicular maksudnya dia ada liquid dekat dalam tu, macam ada fluid. And then dia ada surrounding erythema tu maksudnya merah lah, merah around it. So kadang-kadang dia start dengan dot, lepas tu dia start filling up. So sometimes orang start with a few dots tapi tak nampak pun macam, so orang tak tahu apa benda ni, lama-lama baru nampak, oh dia keluar this fluid kan. So this is chickenpox. Okay, so what do you do when you have these rashes? So kalau you ada like measles or rubella yang macam tadi punya kind of rash, biasanya the patient yang ada measles dan rubella ni, they tend to be very unwell lah and very miserable. So dia bukan macam just normal cold and flu, dia actually quite macam bunged up, kerana ada conjunctivitis, dia ada very runny nose and just very unwell looking lah. So the treatment is, you treat the fever, you make sure they have fluids. The treatment is very similar je dengan any other viral illnesses. Cuma you have to look out for kalau ada increased work of breathing. So macam tadi yang kita tengok dalam video tu, kalau dia orang punya breathing start become very rapid, very fast, and you nampak dia ada indrawing tu, ataupun dia then you need to see a doctor sebab measles ni kadang-kadang dia boleh ada complication. So it can go into the lungs and it can cause penyakit lah dekat dalam the lungs. So then you get that kind of symptom, increased work of breathing. And then kalau dia ada drowsiness, so drowsiness ni sebab measles can also attack your selaput otak, so you can get meningitis from it, encephalitis. So kalau dia ada drowsiness, then you need to go and see a doctor. Ataupun kalau dia ada severe abdominal pain, so severe tummy ache lah. Kalau dia ada severe tummy ache, you need to see a doctor juga sebab sometimes it can attack the organs kat dalam your tummy. So only jumpa doktor kalau dia ada any of the symptoms. Kalau tak, kalau it is just the rash and dia ada runny nose and a bit of a fever, tak payah bawa jumpa doktor sebab dia very contagious. So kalau setakat kita nak diagnose, there's no really point lah sebab we are not going to do anything different apart from cakap fluids. Sebab right now kita ada banyak outbreaks of measles, and the reason being is because ramai orang dah tak vaccinate anak kan. So bila kita pergi jumpa doktor, sometimes you can infect orang yang dekat waiting area tu. So kalau anak-anak tak ada any symptoms, increase of work of breathing atau drowsiness atau tummy pain yang severe, just let them stay at home and treat them as any other viral illnesses. Sama je. So jangan bawa jumpa doktor lah kesimpulannya. Sebab it doesn't matter if you diagnose with measles ke, you diagnose rubella ke, you diagnose viral illness ke, the treatment is going to be the same. Cuma you're going to infect a lot more people. So it's better to just stay at home unless you ada any of yang symptom tadilah. Kalau for chickenpox pula, they may or may not have fever, and the treatment is sama macam viral illness tadi, kita treat the fever, bagi fluids. You can also put on calamine lotion. So calamine lotion ni dia boleh beli kat pharmacy, dia macam bedak sejuk sikit, it keeps the skin nice and cool. So dia macam membuatkan tak ada rasa gatal sangat lah. Lepas tu you can give Piriton. Piriton ni pun boleh dapat kat pharmacy for the itchiness. Cuma kalau it is younger babies, then younger babies ni memang kita kena, kalau dia nampak very gatal kan, kena jumpa doktor sebab nak dapatkan prescription. So babies kita tak boleh, diorang tak boleh buy over the counter je Piriton. Tapi we do give Piriton to babies, but normally under medical advice sebab doctors nak kena tengok dia punya history of the baby. Sebab Piriton ni bawah 2 tahun ke 1 tahun, macam kena tengok dia punya medical history dulu lah. So sama macam measles dan rubella, so you don't have to see a doctor unless yang tadilah kalau babies nak Piriton ataupun they have macam measles dan rubella tadi, they have increased work of breathing, ada drowsiness, ada severe abdomen pain. Sebab chickenpox virus ni pun sama macam measles, can attack all other different areas. So the lungs, they can affect other areas juga lah, around the brain. So kalau dia ada any of the symptoms, kena bawa jumpa doktor. And the other one is actually kalau nampak any of the rash tu dekat around kelopak mata ataupun actually on the eye itself. Because dia boleh, kalau dah ada chickenpox lesion on the eye, it can cause corneal ulceration. So they need some drops. So dia kena, kalau ada nampak around the eyes, you need to see the doctor. And also kalau the rash tu dah looks infected, so kalau dia nampak very red and the fluid dalam rash tu, instead of clear fluid, dia nampak macam ada pasi, so macam warna yellow and angry looking punya rash tu kan, then you need to see a doctor sebab sometimes they get secondary bacterial infection daripada dia dah garuk-garuk tu kan, lepas tu dapat bacterial infection on the rash itself, so perlukan antibiotic, so you need to see a doctor. Okay. These are the kind of rash that we want you to look out for. This one dipanggil petechial, so dia nampak macam dot merah. This one dipanggil purpuric, so dia macam dah bergabung dan jadi benda yang besar. So macam mana nak tahu it's a petechial or purpuric rash ni? Sebab dia, anybody can have this dot ni kan. So the way for us to test is actually, it's called the glass test. So you put a clear glass over the rash and then you roll it on. Masa you roll tu, just have a look at the rash. Kalau it doesn't blanch, like these two rashes ni, it doesn't go away masa you roll the glass over the rash, then you need to see a doctor. Sebab this is a petechial or purpuric rash, especially kalau you ada fever with it, lagilah memang you kena jumpa doktor sebab they can mean a lot of things. So petechial and not purpuric but petechial rash especially, it can be just from a viral infection, tapi it can be also from something nasty, something yang more severe than that. So things like, kalau siapa pernah dengar meningitis caused by meningococcal, so ada a type of bacteria nama dia meningococcal, and then dia boleh cause macam septicemia, maksudnya it goes into the blood and it cause infection in the blood, and then dia punya symptom dia, one of them is this petechial rash lah. Dia mula start dengan dot merah ni yang doesn't go away when you roll this glass, and then dia jadi purpuric and actually the child will become unwell quite quickly. And dia punya symptom is fever and this rash kadang-kadang. So kalau ada this rash, please jumpa doktor sebab dia ada banyak diagnosis. It can be just nothing, but it can be something. So biar doctor have a look and they can decide whether benda tu tak ada apa-apa, they can go home, ataupun whether it is something that needs to be investigated. There are ada juga other kind of disease yang you can present with petechial rash, contohnya low platelets, so macam dia panggil ITP. ITP ni dia ada low platelet, therefore you dapat this bleed kat bawah kulit, so you akan dapat this petechial rash juga. Tapi apa-apa pun, it's better to get a doctor to check you lah. So this rash is to look out for. So kalau you ada this bintik-bintik merah ataupun this besar punya benda purpuric rash yang bawah ni, and then if you put a glass over it, it doesn't blanch, it doesn't go away, and then especially kalau budak tu ada fever, please bawa jumpa doktor because then doctor can assess and say whether they can try and find out the cause. So that is petechial or purpuric rash. Okay, this last slide, this one is eczema. So eczema ni very common, we see them very common nowadays. Tak tahulah whether is it food or is it genetics. So dia belongs to an atopy kind of disease which is associated with asthma and hay fever. And dia boleh start anytime and it can resolve, dia boleh berhenti at any time. So kadang-kadang mak-mak kata dulu tak pernah ada pun, they can start bila-bila at any age. Sometimes adult pun ada yang tiba-tiba start ada eczema kan. So eczema ni dia macam ada spectrum. So it can be very mild eczema, it can be very severe eczema. So kalau, tapi the treatment is still commonly the same lah. You bagi emollient. Emollient ni maksudnya moisturizer. So bila nak kata moisturizer, dia a bit difficult lah sebab sometimes different moisturizer works for different child. So memang sebenarnya kena banyak bersabar lah bila ada eczema ni sebab sometimes guna one moisturizer, dia tak elok, after 2 weeks kena try another one, lepas tu kalau elok, fine. Kalau tak elok, kena try another one. I know a very good brand, Aveeno, memang dia memang very good, but it is quite expensive. So selalunya GP don't start on Aveeno. They will start on other kind of moisturizer. And sometimes bila dia merah macam ni ataupun yang macam ni, tapi kat muka biasa it's a bit more difficult to treat lah. Kalau kat tempat-tempat lain and very red, kadang-kadang doctors they will prescribe steroids. So steroids ni you don't use them all the time. You use it bila dia tengah flare up, bila tengah angry looking tu kita bagi steroid. Bila dia dah calm down tu kita kita must put emollient. So eczema ni tend to be dry skin. So macam the way it works is kita keep it moisturized. But intermittently kadang-kadang dia ada flare up. So that is known. Memang dia bukan bila kita bagi emollient dengan steroid ni, it's not gonna treat. Dia kadang-kadang time will make it better. Maksudnya sometimes orang grow out of it. Some people just don't grow out of it. Then it's a lifelong punya disease lah. That maksudnya you akan kadang-kadang ada flare up of your eczema, kadang-kadang dia jadi belok, kadang-kadang dia jadi balik. So currently we still don't have like a treatment lah yang macam boleh just treat benda tu. Kalau kita tengok budak ni, he's got very severe eczema on the face. And kalau tengok around his mouth tu, dia ada macam yellowish discoloration tu kan, crusty yellow tu kan. Itu is a sign of infection, so impetigo. So kalau ada macam yellow, macam ni, anak kita ada eczema, lepas tu kita nampak ada yellow crustiness ni kan, and very angry looking red ni, maksudnya dia dah infected, so we have to see a doctor so that we can get some antibiotics. Okay, so this is the last slide. So how do we seek help? So kalau kat Malaysia, saya tak berapa sure lah kat Malaysia macam mana sistem dia. Tapi kalau kita kat UK ni, the system is kita always the first one is to self-care. So maksudnya kat rumah kita boleh buat all kinds of things macam tadi lah. For cough and cold, kita boleh bagi paracetamol kat rumah. Just look out for the symptom yang bila kita kata oh kena jumpa doktor tu kan. Bila kata seek medical help tu, that's only when you bring to see a doctor. Kalau tak dekat rumah tu you can do a lot of things for your child. Cuma sebab once you dah faham kenapa dia sakit, insyaAllah kita just bear with it and macam support your child. Unless dia ada the symptoms yang macam saya bagi tahu tadi, kalau dia ada those symptoms then bring jumpa doktor. Kalau tak, you can take care of your child kat rumah aja. The second one is NHS 111. So if you ring 111, you get this NHS punya support. They're quite good sebab dia boleh triage kan. So dia akan tanya apa simptom anak, umur anak, ada medical history apa ke tak. Dia akan guide you whether to go to GP je ke, pergi ke kena call ambulance ke kena datang A&E ke. So they will tell you where to go. So 111 ni is actually quite good. Unless you have a friend yang doktor kanak-kanak and they can help you, you can ring them as well lah. Tapi 111 ni is quite good kalau you tak ada any doctor friends. The next one is actually pharmacy. So pharmacy is quite good because pharmacists, they can prescribe certain medication and they can also give you some advice. So contohnya kalau you ada diarrhea, runny nose, headache, simple things, you boleh try pergi pharmacy, see whether they can help you. And then the next one is your GP and out of hours. Kat sini pun termasuk jugalah walk-in center. So kalau kalau Google your nearest children walk-in center, pun boleh pergilah for benda-benda macam ni sebab so they treat benda yang simple yang tak perlu hospital admission lah. Especially children walk-in center tu dia tak ada doctors tapi dia ada specialist nurse, children specialist nurse, and they are actually very good to recognize unwell patient. So GP, the specialist nurse, dia orang memang tahu pasal bila nak kena hantar ke hospital. So you can visit them first kalau you rasa benda ni simple je, budak tu tak adalah nampak tu unwell, bolehlah bawa jumpa GP or out of hours ni. Lepas tu kalau anak-anak kita jatuh, sprain ataupun macam terluka besar kan, instead of pergi A&E, you can also go to minor injuries. Tapi benda ni bukan ada banyak tempat lah. So minor injuries ni kadang dia ada x-ray. So kalau macam budak tu terjatuh, terplank out ke, ataupun dia ada terluka ke apa ke kan, benda-benda macam tu you can go to minor injuries. So they can have a look. Kalau dia orang rasa macam dia orang tak boleh deal with it, dia orang akan hantar ke A&E lah. Tapi kalau tak ada minor injuries dekat your area, you can also go to A&E lah. Sebab A&E dia ada bahagian minors, so dia ada tengok juga bahagian budak-budak yang dia jatuh, yang patah kaki, yang benda macam tu lah. So A&E ni kalau semua orang tengok lah, A&E ni is actually the last one. So bukanlah nak menghalang orang untuk datang, but A&E ni kadang-kadang are crowded by benda yang very simple, yang macam actually boleh handle kat rumah aja. So sometimes a lot of people datang tunggu lama-lama, lepas tu jumpa doktor kata tak ada apa-apa, okey balik. So macam semua orang tak puas hati kan. So A&E ni sebenarnya kadang-kadang they can be very busy. We have a lot of life-threatening punya situations, a lot of emergencies. That's why sometimes orang tunggu, and we do triage. So maksudnya kita tengok mana yang lebih urgent, kita jumpa dulu. So macam kalau pergi A&E ni biasanya pergilah kalau macam bila yang tadi kan kita ada simptom-simptom tu kan, you can go to A&E lah kalau ada the symptom. So contohnya yang increased work of breathing, not tolerating feeds dalam babies. Sebab those things kadang-kadang kena ada hospital admission. So then yes, kena pergi A&E lah. Tapi kalau simple cough cold and ataupun macam chest infection tu, in fact jumpa GP pun okay, sebab they can give antibiotics dekat GP. Cuma kalau they are looks very unwell, then they should go to A&E lah. Lagi satu, 999. So 999 calling ambulance ni, janganlah jangan call kalau benda tu rasa macam setakat nosebleed ataupun itulah kalau seizure tapi less than 5 minutes, ataupun your child is coughing macam malam, tiba-tiba terjaga sebab dia cough, ataupun sebab tiba-tiba temperature dia 39 or 40, don't call ambulance. Sebab if you call ambulance, you're taking a lot of, satu it costs a lot calling out ambulance. Number two is actually you might take orang lain punya, yang orang lagi more emergencies yang perlukan ambulance, but because you've called the ambulance first, so you take the opportunity away kan from the other person. So bukan kata tak boleh call, but call appropriately. So this diagram ni sebenarnya help us to know bila where do we need to get the help from. So A&E is always the bottom of the list lah. Jangan terus call for unnecessary things. So insyaAllah itu saja presentation for tonight. So insyaAllah sekarang ni is for session question and answer. Kalau ada siapa-siapa nak tanya question, bolehlah write dekat chat box tu. Oh, ada soalan lah, sekejap . Sekejap saya buka box ni. Okay, so ada soalan kat sini. Soalan dia, bolehkah kalau anak kena sawan, disiram air pada anak sebab selalu dengar cara tersebut. So kalau anak yang kena sawan ni, I wouldn't advise siram air. I'm not sure is it because orang nak turunkan temperature, therefore kita siramkan air tu kan. So I wouldn't do it. Satu sebab kalau air tu masuk ke dalam mulut atau hidung dia, dan dia akan aspirate kan. Sebab masa dia tengah sawan tu dia tak boleh control dia punya breathing, and dia punya tak boleh nak jaga maintain airway dia tu. So kalau kita siram nanti kan air tu termasuk, dia pun spluttered and dia termasuk ke dalam paru-paru, and they can get aspiration pneumonia, which is infection of the chest sebabkan dia aspirate air tu, and it can be quite nasty. So I wouldn't siram anak kalau dia tengah kena sawan. Lagi satu, kalau anak kita demam, current rules is masa anak kita demam tu kan, kalau kita kat dulu orang ajar kita ambil air kan, bukan demah dia letak kain, dia rendam air, lepas tu dia ni kan, dia letak kat badan kan. Sekarang ni dia orang punya current guidelines is not to do it, sebab dia kata can cause vasoconstriction dekat periphery, so it actually increase the core temperature. So kalau bila ada temperature tu sebenarnya kita just perlu strip them ni, maksud kita tanggalkan baju, maksud jangan pakaikan tebal-tebal, lepas tu bagi paracetamol dengan ibuprofen je. So kalau masa dia tengah kalau masa di tengah sawan tu, kita actually tak boleh buat apa-apa. So kita hanya put them to the side and kita timekan je. So kalau kita rasa timing dah sampai 5 minit and sawan tak berhenti, kena call ambulance. So masa sawan can't do anything much. Sebab kalau kita bring down the temperature pun, it's not gonna stop the sawan. Maksudnya kalau kita try siram air sebab nak turunkan temperature cepat-cepat kan, dia sebenarnya bukannya the temperature, it's actually the rise of temperature that acts on yang giving the seizure lah. That's why kata tadi kadang bukan 40 degrees pun, it's like 38.7 tapi tengah rising kan. And because budak ni more susceptible to sawan, then they get the sawan lah. So kalau to answer that question, kalau anak yang sawan jangan siram air lah. Just buat yang tadi, put them on the side. Okay, kita ada next soalan. Adakah patut risau kalau anak masih tak boleh sit unsupported and tak nak baring atas perut by 8 months? Okay. So kalau sit unsupported ni is by 10 months. So kalau by 10 months they are not sitting unsupportedly, then kita bukan perlu risau, but biasanya kita perlu bawa jumpa doktor just for assess, and then dia akan buat developmental assessment. So some children dia ada slight delay. So macam by 10 months dia tak duduk unsupported, tapi kalau dia macam tu biasanya doktor akan examine, akan check dulu. Kalau examinations are normal, dia akan cakap kita follow up. Maybe lagi sebulan kita akan tengok balik macam mana dia. So it's not to say we should worry, but it should be we should get medical help. So kita kena bawa jumpa GP lah. So kalau they are not sitting by 10 months, sitting unsupported 10 months, yes. Untuk yang tak nak baring atas perut tu sebenarnya preference. So biasanya budak yang tak biasa tummy time, dan dia tak akan minat, dia tak akan sukalah duduk atas perut. So yang tu tak apa, yang tu bukan part of masalah development, tu biasanya masalah budak tu sendiri yang tak nak, tak suka duduk atas perut dia lah. Macam seperti benda-benda lain, manusia ni kita ada variant kan. So one person might like this, one person might not like it. So maybe your baby just don't like to sit baring on their tummy je lah kot. So kalau dia just don't like tu tak apa. Cuma kalau tak banyak tummy time tu nanti dia ada susah sikit nak yalah macam dia susah sikit nak develop into crawling, into ni kan. So what you can do is just galakkan. Sometimes you just put them you put them on the mat, lepas tu letak them on the tummy, lepas tu letak a lot of mainan in front of them yang macam dia boleh tarik-tarik, try to, and you can tak payah buat lama, so every time mungkin 5 minutes, bila dia nangis tu angkat, tapi get them just to familiarize on their tummy lah, tummy time diorang tu. Okay, ada lagi soalan ke? Okay, ada soalan lagi ke? Okay, kalau tak ada soalan lagi, kalau tak ada soalan lagi, insyaAllah I hope everyone gets something out of this. Kalau ada kesilapan tu, saya minta maaf lah, mungkin daripada the lack of knowledge that I have. Tapi itulah untuk kesihatan anak ni, biasanya mothers, they know, mothers and father lah, maybe mother more, they tend to know their children better. So sometimes kalau you just don't feel, you feel something is not right about your child and you can't explain it and it's not in the symptoms yang I've told you pun, if you just feel not right, bawa lah jumpa, at least bring to see the GP so that they can have a look at your child. Sebab I've had cases yang mana tak ada symptom yang you would be worried about pun, but they get something, they do have something. So kadang-kadang bagus jugalah insting mothers ni, tapi kadang-kadang tak boleh ikutkan sangat juga sebab sometimes kita can be a bit over to worried pula kan. So ikutlah, mothers knows best. Satu lagi, just nak ingatkan lah, kalau bagi orang yang Islam tu, anak tu adalah pemberian daripada Allah. Maksudnya kita serahkanlah pada Allah sebab sometimes you can't be too worried about your child. So macam every single thing, sebab banyak aja kadang-kadang diorang yang ada this disease, they don't have those symptoms that I've said. So tapi bila bawa jumpa doktor, tak didiagnose sebab tak ada those symptoms. Lepas tu tiba-tiba dia meninggal because of a complication yang tak boleh didetect oleh doctors pun. So samalah, doctors ni hanyalah orang yang diberi ilmu sedikit je daripada Allah. Tapi sometimes kita orang pun ada terlepas pandang certain things. So tapi majority apa yang kita jumpa, that is it lah. Tapi kalau benda yang macam kecil-kecil macam tu and it happens, kita kena terimalah yang anak ni pemberian Allah and he can take it anytime he wants. So bila benda tu terjadi dan kita kena redha lah. Bila kita ingat pada benda tu, kita tak adalah over worried dengan anak kita. So kita try our best, try to look out for the symptoms and bawa jumpa doktor appropriately bila kita rasa perlu. Tapi if anything does happen, macam katakan dia tak ada the symptom, tiba-tiba je dia, sebab ada je yang sudden death kan, sudden death, infant death, dipanggil cot death tu. Bila it does happen, then kita tak boleh buat apa lah, itu memang dah ketentuan Allah. Allah nak ambil anak kita tu, maksudnya dia nak beruji kita kan. So kita just kena remember lah, anak ni pemberian Allah, he can take them anytime they want. Kita hanya buat yang terbaik lah yang kita ni, so that kita tak adalah over risau pasal anak-anak kita. Terima kasih sebab mendengar. Kita berjumpa lagi dalam another session of medical initiative by Ikram. Assalamualaikum warahmatullahi wabarakatuh.